Alright, this exercise is called side glide in standing. It's used for back pain, often with leg pain. It doesn't matter how far down the leg the pain goes, provided that after this exercise the pain afterwards is clearly better or starts to shift out of the leg. So even if there's a slight increase in back pain, provided the leg pain recedes out of the leg, it indicates it's the appropriate exercise. So for the person that needs this side glide, many of them come in crooked, which is called a lateral shift. So if we get Ash to lean to the left here, so the typical person leaning to the left will have right leg pain, although this is not always the case. Okay, in this scenario, if you're leaning to the left and the pain's down the right leg, what we want to do is then come over to the wall. Okay, lean your shoulder on the wall, bend your elbow against your rib cage, feet are together, about a foot from the wall, so come slightly further away. Alright, now this is the starting position, and what we want to do is, keeping the shoulder on the wall, slide your hips away from the painful leg, and gradually Ash is going to keep doing this with repetition. If you're not limited by the pain, you gradually want to go further with each one. Once Ash is able to start to get towards the wall, provided that the symptoms are easing or coming out of the leg, more pressure can be applied by placing the hands on the hips and then just slide across, all the way over and back again. Now typically 10 to 12 repetitions are done at a time, and provided that the symptoms are relieved after, it would indicate it's appropriate. If you're in doubt, particularly with difficult leg pain, it's always better to see a McKenzie credentialed physiotherapist first to determine this is appropriate for you. If the exercises are helping and you start to be able to reach your hips towards the wall but the symptoms aren't fully resolved, to increase the range of side gliding, we can place a pillow between the shoulder and the wall. Okay, Ash, now do the same thing, push all the way across so the pillow enables a greater range of side gliding, which particularly if the exercise is relieving the leg pain, it will give further relief by allowing a bigger range of movement. Now, provided these exercises are relieving the pain and afterwards you're less crooked, so come away from the wall. So Ash would be straighter now after doing this. Usually it's followed with 4 to 5 extension exercises, so just face this way, Ash. Place your hands in the small of your back, keeping the knees straight, just arch backwards 4 to 5 times. Now, if the arching back exercise ends up making you become shifted again, it indicates you're not ready for this yet, and you should just continue with the side glide only.